Well, Mark, the chief medical officer here told us that he thought he had survived the peak of the pandemic back in January, but now they are preparing to handle twice as many COVID patients as they saw over the winter. And he says, really frankly, that this is frustrating.
We prepare and we plan.
It's never been this bad.
We are by far in our largest surge currently for COVID-19.
To make room to handle additional patients,
We actually had to do a lot of work with wiring.
the conference room and waiting areas at Providence St. Peter Hospital are getting a COVID makeover.
So now we've converted this area actually into a surge capacity area.
Dr. Kevin Caserta is the chief medical officer for Providence, Southwest Washington.
This is why we do things like this, to be ready in the worst case scenario. But in all honesty, I hope we never have to use this.
These beds would be used to handle non-COVID patients, making space for what the hospital predicts will be as many as 120 COVID patients in the coming weeks. That's twice the number as the past peak in January.
Our caregivers are very tired. And at times, we all can become frustrated because this pandemic does not need to be at the levels where they are right now.
He blames low vaccination rates, especially in the more rural surrounding counties served by his hospital's network. There are also staffers here who are not vaccinated. But Dr. Caserta says as the hospital makes moves to deal with the surge, it's time for everyone to work together.
We need to treat each other with respect and compassion, even if we have differing opinions.
Late this afternoon, the state's Department of Health granted Providence St. Peter permission to start putting patients in those beds. However, that will not be happening quite yet. The doctor said it's possible they won't need the beds, but he also said it's quite possible all of those beds we saw today will be filled by the end of next week. Live in Olympia, Drew Mickelson, King 5 News.